Hi everyone, I'm Rekha Muddaraj in the KHOU 11 newsroom. It's just after 1 o'clock on this Thursday, and we know that so many of you have questions about the coronavirus. So we keep bringing experts in, hopefully to get those questions answered. This is Isabel Valdez with Baylor College of Medicine. Thank you so much for being here.
Thanks for having us here.
We really appreciate it. We're so happy that you can be here today. Really, a lot of people have questions about this as the situation develops. But first, tell me a little bit about what you specialize in.
So I'm an internal medicine physician assistant, and as a physician assistant, I do a lot of the same work that your doctor does. So you'll probably see a nurse practitioner or physician assistant when your doctor can't see you. So we have a similar training as doctors do, just in a fewer years. And I've been doing this in primary care now for about 10, 12 years. So I've got some years under my belt.
You know, we're talking about the coronavirus, the latest developments, of course. The community spread case is what a lot of people are worried about, because our initial cases came from folks who had traveled abroad and then come back. So we have this community spread case. It is essentially why the rodeo was shut down. As a person who understands public health, was this expected?
The expectation was that over time we were going to have community spread, and as dynamic as an international city as Houston is, it was only a matter of time. I mean, we saw it happen in New York and with travelers, and also with travelers on cruise ships in California, and basically both of our coasts. But we're in a similar situation because we're a huge hub. So it was just a matter of time before we got hit too. Yeah.
One of the most pressing questions we keep getting from viewers, and again, if you're watching this Facebook Live, please comment, let us know about your questions, because she's definitely going to answer them for us today. A lot of people are wondering, look, I have symptoms of something. I'm not quite sure what it is. If I suspect coronavirus, what is the first step I take?
So let's lead with, there's more often than not, you're probably going to have something that resembles sniffles, common cold, and maybe even the flu, because we're still in that time of year. And let's add the bonus of allergies. It's allergy season now. Our cars are now yellow. There's allergens everywhere. So those are also possibilities. So not every symptom equals COVID-19 or coronavirus.
Okay.
So the big symptoms that we want to watch out for that could be suggestive of testing, of the need to test you for COVID or coronavirus, would be high fevers. And I get this a lot from patients. I never run fevers. I'm pretty lucky that I never have fevers. This will give you a fever. So pull out those thermometers, clean them up, get some thermometers if you don't have any, and track your temperature, because a fever over 101, time to call your doctor. So that's step 2. The other symptoms you want to watch out for is a cough. It could be wet, it could be dry, but if it's a cough that's triggering a difficulty of shortness of breath, a difficulty with breathing, shortness of breath, you definitely are going to catch your doctor's attentions with that. So cough with shortness of breath, fevers, those are some of the hallmark issues, symptoms that we're seeing with this. Of course, you're still going to have the occasional sore throat. About 13% of the population with COVID are reporting sore throat, but not all sore throats are created equal. Your sore throat might get better, your sniffles might get better. So definitely call your doctor. Don't rush to the ER. Don't rush to your doctor's office either. Call them. Let them ask you the appropriate questions to see if you're in that group of patients that might need to get tested, so that if you need to get tested, they'll meet you and they'll run every hospital has protocols to test patients. Not everybody's going to get testing, but definitely sore throat is lower on the scale, but those high fevers, those a cough with shortness of breath, those are the main ones. If you start having those, call your doctor for sure.
And you know, earlier, because we thought this was something that was associated with traveling abroad, folks were saying, well, you know, I haven't gone anywhere, so it's probably the flu, it's probably allergies or something else. But now with the community spread case, that has changed. The parameters have changed.
Absolutely. The risk factors are going to be a little bit higher. Right now, we are following guidelines that say if anyone presents with these symptoms that I mentioned earlier, as well with a contact with a having traveled to a high-risk country, or B, direct contact with a traveler, we're definitely going to heighten our alert system and get you in for testing. This community spread has changed the game a little bit, and it is a developing story, and guidelines and protocols are coming up from every possible hospital, including the CDC. So stay tuned and definitely contact your doctor if you're concerned for that.
So to reiterate, don't go to your doctor, don't go anywhere, call first. That is vital, because then I'm assuming someone will get on the phone with you and kind of go through this checklist that you gave us.
Exactly. We have a checklist. We are going to screen you before you come in. And if you are screened and their doctor on the phone or the nurse on the phone says, you know what, we definitely need to get you in for testing, they'll have a protocol to walk you safely from the door of the hospital to the testing room.
Oh, yeah.
Because it's in the walking. Like if you just walk into the ER and let's say you are a possible candidate of corona and there's 20 people around you that don't have that, you might pass it on to them because this passes by close proximity. The droplets of your saliva when you cough and when you sneeze, that's how you pass it on to others. So I mean, I hate to say that they closed down the rodeo, but if we think about it, it's the close proximity that you can't control.
Yes.
And that's how you can pass it on to people in the emergency room, like you could have passed it to someone that's sitting next to you at a concert.
Yeah, that's true, and it's probably why we were just hearing that Montgomery County is saying to cancel events that have more than 250 people in attendance, which seems like a good proactive move.
Yeah, it's a very good number to kind of try to, again, you're trying to contain the spread as much as you can. I think we heard that yesterday too when they interviewed NIH. The idea is to try to contain the spread as much as possible because the spread is going to happen.
Yeah.
You just want it to happen. If it's going to happen, let it happen slowly.
Yeah, absolutely contain those cases. This might be premature to ask, but Renelle is asking, are we going to see a decline of cases and life get back to normal, and when will we see that?
According to my crystal ball, I can't tell you.
I know, that's
it's
hard.
a very foggy crystal ball, so I don't have an answer for that. The goal is that if we can slow down the transmission, again, by taking these measures, aggressive measures from our civic leaders of like closing down these large gatherings, we can slow down the spread so there's that less people get infected or affected. Again, the spread will happen, but if we can slow its pace down, maybe we'll see some normalcy, but I have no idea when. My crystal ball is really foggy, so I can't tell you.
It's going to be hard to tell for the next couple of weeks at least.
Right.
When they shut down the rodeo yesterday, a lot of people were very angry. They thought our officials, city leaders, county leaders were overreacting. A lot of people saying, look, the flu kills, thousands of people a year. This is doing the same thing. It's just another flu. But you obviously have science and sound medical advice to dish out to people. What would you say about that measure and why it was so important to do that?
So that measure is in line with what not just the NIH and the CDC has been recommending, but even the World Health Organization has been saying this, and they actually have been saying that for a little bit longer than we have been listening to them. So we're in keeping with the recommendations from World Health experts, because what we know about any kind of infection that's spread by droplets, it's in the saliva, it's in the sneeze, it's in the cough, and people around you will catch it. And we know that it's very contagious. And as contagious as this infection can be, it's going to make it harder to slow it down, put a brake on it before we can actually stop it completely. So we can't stop it, unfortunately. So the best we can do is slow it down, and our civic leaders have made decisions to that. So again, it's in line with what's recommended, and we can only, maybe we'll see we'll just have to have turkey legs next year and the fried Oreos next year, maybe 2 next year because of that, but not this year.
Not this year. Along those lines, Juanita Duran was asking about, we know that it's contagious, but how long does the virus stay on surfaces?
I've heard, that's a great question, and I've heard a lot of different values. I've heard as little as just a couple of hours to even on some surfaces lasting, especially fabric-based surfaces can last for more than that, maybe even days. So the recommendation, as always, wipe down frequently used surfaces, stainless steel surfaces, if they're cloth surfaces, any kind of surface, plastic, formica, you name it. Wipe it down with disinfectant. Don't forget to wipe down your phones.
Yes.
Don't forget the keyboards, be it at home or at work.
Yeah.
Tables, of course, anything.
Door handles.
Yes,
that's
particular.
big.
Don't forget that, because remember that what I said earlier about the rodeo and closed spaces. Yes, we can spread this on by like coughing and sneezing, but then that same saliva lands on a surface.
Yes.
It stays there, and somebody else touches it, touches their face, goes to what we've been saying earlier about washing your hands. Don't touch your face, cover your cough and sneeze. It goes back to all those basic instructions, because from the surfaces it can get on you. So it can last for hours to days. So definitely get those wipes ready.
Yeah, absolutely. So we talked about how when you cough and the saliva and you're in close proximity to it, that's kind of how you contract it. But is it also just floating in the air that we breathe? That's a question from Sue Thompson.
Assuming that you are breathing air from someone with the contamination. So if you're at home and it's just you and your cat and chilling, and unless your cat has it, which God forbid she or he does, you're going to be fine. If you're home, it's again, if you're in the proximity of someone who is showing symptoms, and I mean, we're thinking about, I'm going to be breathing in coronavirus. You're probably breathing in also their common cold virus or their flu virus. So we've got this hyper alert concern because of the COVID-19. But remember that the other one that's passing on just as easily, just as readily, and probably more commonly right now is a common cold and the influenza. So if you haven't got your flu shot, go ahead and get it. And you could be breathing in someone who has the common cold virus. You're going to catch it just as easily. It's the same transmission. Yeah.
Let's see, as I look at, okay, so this is a good question actually from Trisha Pike. She's asking, how do they test for this? Is it just a swab from the mouth or is there a blood test involved?
Oh, good question, Trisha. I'm so glad you asked that because it's not that simple. Unfortunately, with this virus, it is fortunately and unfortunately, it is a swab, but it's not just in your nose. It's a little bit further back. So it's not going to be as easy peasy lemon squeezy as other tests have been. It is a throat swab as well. It depends on the availability of the test that your doctor or your hospital has. So it's either
so not just from a little from the cheek. You're going back there.
Back to the throat.
Okay.
I often have patients like, oh, watch out! I'm going to gag when I do this test. It's that level of testing. So so it's not a blood test. Again, it has to be a sample that's taken far back. From the far part of the nose, back in the nose, or in the farthest part of the throat. So it's a different kind of Q-tips. And I know, and to a point that she asked to, a lot of patients are used to, I go to the doctor, I'm going to go get tested for the flu, 5 minutes later, I have my results, it's negative, and I'm go about my day. Unfortunately, with this test, because it's still the novel coronavirus testing, it's still in limited supplies, and it's still being developed in some cases. It's not going to be a result that's going to come back right away. So expect a more invasive test. Expect no results for 2, 3, or more business days. It might take a little bit longer. And it's not a test for everybody. Right now, we talked about earlier about that checklist. If your doctor or your nurse go through that checklist with you and find that you check off on that, you're checking off all the right questions on that list, you may fall into the group that gets tested. And again, your nurse, your doctor, your hospital will make arrangements to meet you to get you to the right place for testing.
Wow. Okay. So it's a little bit. There are a few more steps than just say if you're getting tested for the flu.
Exactly. And don't be alarmed if you're in the group of patients that needs to be tested for this. Your doctor's going to put on a hood-like respirator or a face shield. We have to wear gloves, double gloves, long gowns, not just like the one I'm wearing now. This is considered a very contagious infection, a contagious virus. So we are going to protect the healthcare workers that are going into the room. So we're talking gloves, face shields, a respirator in some cases, gowns, and double gloves. So it's because we also don't have enough of those protective equipment. It's not that we're going to test everybody. So we've had some cases where patients say, "Can you just test me real quick because I need to get back to work, and I'm not going to they're not going to let me go back to work unless I test negative." I call out to the employees out there. It's not feasible. That's not feasible. That's not reasonable right now. That level of testing, of accessible testing, is not there. It's limited. We have it, but it is limited.
Given all of the factors now, I'm guessing it's smart for businesses, employers to start thinking about ways to allow employees to work from home, have a contingency plan if a good number of your workforce is wiped out just due to this virus. It's probably good that they not only start thinking about it, but maybe put some plans into action. I leave it to them. It's above my pay grade to answer that question, but I think it's a brilliant idea if you have that ability. Of course, your healthcare workers are going to be at front line. We're going to be there because I can't test you over the phone. So I'm going to have to look at your nose to do that. So
But yes, if they can do that, that might be helpful, because you want to, again, with the point we made earlier about keeping the large groups to contain to as little as possible and stopping that spread. Staying at home is the best way to not spread it.
That's smart. And so you have personally had to test people so far?
Not yet for this flu, not personally.
Not for this one, okay.
No. But I was part of the group at Baylor that did some of the training material for the rest of our college, and it's something that I'm a little familiar with just gowning. We have to don and doff a lot of equipment that we don't have. We don't have hundreds and thousands of gowns just laying around for this kind of level of testing. Yeah. So and it's really hard to breathe in that respirator.
No, and I'm so glad that you talk about the steps that you have to take, because it's a lot more involved, and people think it is a drive-by, maybe someone swab you in your car so you're not infecting other people, but there is a little bit more involvement that's required for this level of testing, and I think that's important to note, because a lot of the public wonders, why can't you just do it faster?
Right.
We have kits now, right? We've got a place where we can send it now. We don't have to send it to the CDC, but there is a lot that's involved in it, and multiple steps.
Exactly. Yeah, and I have to give it to just in the last week we've made some progress, because last week we were having to send any and all testing had to be sent to Atlanta CDC. Now we have them here in the city of Houston, but again, they're in limited supply, and again, it's going to take a while. It takes a while to collect. It's not as easy, and it's going to take a while to get the results back.
Absolutely. Last night we heard the president speak, talking about a travel ban, essentially not letting anyone who is not a U.S. citizen back into the country right now, at least for 30 days, to kind of stop this pandemic as much as possible. Right. But a lot of folks, especially with spring break coming up, are wondering about domestic travel. I know a lot of people have canceled flights. A lot of airlines are very forgiving at this time, but people think it's an international thing. But what are your thoughts on domestic travel?
You're asking, so that's a very difficult question to answer. And it's a kind of a personal opinion. I guess it really is. It becomes a game time decision. But here's why, as a medical professional, using the guidelines given to us by the WHO and everyone else about being in groups. Think about it. You're in a plane. It's not going to be just 10 people. It's probably going to be more than 100, maybe even more than 250, like Montgomery County set that number. I don't know how they came up with that number. I don't have the science behind that, but I'm sure they did some research. So you're going to be on a plane with probably 100 to 250 people already. You're going to be next to people less than a foot away from you. Yes. And you're already going to be next to someone who's coughing. And this whole idea of containing the spread, the whole idea that we've had right now to now is contain the spread by containing everyone. Yeah. We're not really containing ourselves if we're going from here to Atlanta to Chicago and et cetera, or accepting company from Seattle, from California, or other places that have tested positive. So I'll let you make that decision. It is yours. It is a game time decision. It's how it affects your work travel, your personal travel. And you also know your health risks. If you have lung conditions, if you are in the older population is more adversely affected by this, they're at higher risk. People who have heart conditions, who have cardiac disease, who have diabetes. If you have all these conditions, if you have COPD, if you have asthma and other lung issues, you have conditions that make you more vulnerable. So if you're vulnerable to begin with, in a tight space, flying across the nation with someone that might just be positive 3 rows down, that's still enough of a distance for you to breathe in there and inhale. So it's a difficult decision. You have to make it with your heart and with your mind, but especially with your health in mind. Yeah, absolutely. And it's funny because our family canceled a trip. We were going to go out to Phoenix to visit my parents, but then I thought, even if I wiped everything down, my kids are still going to touch the railings. They're still going to touch the elevator buttons. They're still going to touch the tickets and the touch screens. And so there's that risk. And then also, when you go to visit parents and elderly parents, anyone over the age of 60, you wonder, maybe I might not get the symptoms, I might not get a severe case, but passing it on to them could be detrimental. So you're right, a lot of things to consider. It's a lot, and I think you just nailed something that's important. I want to hit that tangent in that I might get it myself and have mild symptoms, because the younger population, particularly kiddos, they might be carriers and have mild symptoms and mild infection, and they power through. Kids always rally.
Yeah.
We take a little bit longer to rally, but our loved ones, our beloved older patients, don't rally as quickly as we wish they did. So we might be infecting them even when we don't have symptoms ourselves.
Yes, and that is important to note. All right, so I saw that Trisha Edwards was asking about her family planning a trip to Vegas in a couple of weekends. Should they still go? You saying it's a very personal decision and to consider all of the facts, not just yourself, but what you could be, you know, risking for others as well.
Exactly.
Good to know. Okay, let's see. I'm going through these questions, and thank you so much for sending them to us. Okay, here we go. So Megan Green has a kind of specific question here, but good to understand, involving children. She is asking, are children with heart defects or who have asthma more at risk? I know it states that obviously the elderly will have an issue if they have, especially with, you know, if they've had pneumonia and other respiratory issues, but children with respiratory issues, is that going to be a problem?
I'm going to have to defer to a pediatrician, knowing how this virus is behaving, and using my limited knowledge with children as a pediatrician, because I don't really work with kids anymore. I'm going to say err on the side of caution, assume that they are just as much as risk, and definitely take the same precautions with kiddos. I think her son had heart condition and asthma. So I mean, that's a double whammy right there. Asthma, compromised lungs, heart condition, you're going to have a harder time recovering from any bacteria, any virus or bacteria that he come into contact. It's going to take a time. And I bet too, if she or he has a heart condition, they're probably on medications that lower the immunity. So that's like a triple whammy maybe. So medications that lower your immunity, 2 different medical conditions. I'm going to say err on the side of caution and keep your baby nice and safe at home.
Yeah, that is a good call. Eric Hoff is wondering, and this is a question a lot of people are thinking about, you know, the flu goes away when the spring and summertime hit. You know, we think, okay, warmer weather, people are not in close proximity of each other all the time, and it just kind of dies down. Do we see this virus, the coronavirus, trending in this direction as well, or is it too early to tell?
I think it's too early to tell for starters. I should actually preface it with, it's called novel for a reason. It's really brand new. So we're still learning how it behaves, not just here, but also in the rest of the world. And we have China to thank for, I guess, because they were ahead of the curve and that they got affected first. But
they took the brunt of it, in many ways,
because it started there. They're seeing a light at the end of their tunnel. So I can only, and they've had some, I think their first case was sometime in the winter, December, January. So, and not too long ago, they reported fewer new symptoms, I believe this week, if I'm not mistaken. So in 3-4 months span, they are seeing a light at the end of the tunnel. I would like to extrapolate from that and say perhaps us too. But I'm not an epidemiologist. This is a novel virus. We are behind in the game. We are behind the game. As far as testing ourselves. And people are still wanting to travel and wanting to go to large events. So we're still fighting we want to go back to it. So we might not see the end of this anytime soon. We just don't know.
It's hard to tell.
It's a really tricky question. I'm as you can tell, I'm extrapolating here, and my crystal ball is super foggy on that one. My magic 8 ball is not giving me an answer.
No, it's hard. You're right. It's hard to tell if weather will interrupt it or if it's just one of those things that will run its course no matter what.
Right.
And so that is hard
and in how long.
And in how long. That's very true. Liz Coleman saying, thank you very much. I like these professional answers that you guys are giving. Thank you.
Thank you.
This is great. All right. Okay, can you spread the virus if you sweat? Because it's spread with droplets. Instead of so we're talking about cough. I never thought of this. That's a really good question from Danielle Young. Thank you. I think I mean, again, we don't know so much about this, but there's sweat.
Danielle, you stumped
That's
me.
Pretty good.
I'm thinking about car talk. You definitely stumped me, and I'm going to err on the side of caution and say yes, possibly because it is a droplet.
Yes.
But it is yes-ish. The studies have been shown with respiratory droplets. It is a respiratory, so that makes me think of anything from the lungs up. You're sweating. It's a different location, but it doesn't hurt to still wipe down things that you've sweat upon.
Yeah.
It is the respiratory droplets. It has been what we've been taught, so I'm gonna say yes-ish, more on the no-ish. Now I'm changing my mind there.
So
maybe
maybe
not so much to sweat, but still wipe things down if it is sweaty. Again, it is a respiratory droplet. That seems to be the main source of transmission that I know of, and we'll have to get back on the books to look that one up to be sure, to be absolutely sure.
Yeah, Danielle, that's a great question, but we can definitely
stumped
look
me.
for hours.
Good work.
But a lot of people obviously going to the gym, and you're running, your mouth is open, and you might cough, and you might not even realize it. So always just good to wipe everything down.
Wipe down everything.
Everything
yes,
down.
I
All
know.
right. Let me see. So, Danielle asked another question. How long does it take for the virus to leave your system, and does it ever really essentially leave your system fully, or are there residual effects?
Right now the studies have shown anywhere between 2 to 14 days for it to kind of run its course and get out of your system. It could take even longer than that. Okay. Now we've only started seeing positive cases in late January here in the U.S., so we're still not we don't have a completely good answer on that. I understand that when they had patients in quarantine, they had to have 2 negative tests before they were allowed to go back in public, so that might be the case here. As to how the time frame between the tests is something that I have to look up to get more specific answer.
Okay.
But there was one case at least that was reported that the patient still tested positive after 2 negative tests. Now that positive test that this particular patient had could have been positive, could have been a falsely positive test, or it could have been weakly positive. So we're not really sure. We're still learning.
And that's the San Antonio case, right?
That's
the ones who were quarantined at Lackland. Yeah.
Exactly.
Yeah.
So we still don't have enough data, enough patient exposure, patient data to have a good answer for that. But at least 2 weeks, possibly even longer, though, from what we're learning from this first group of patients that were there at the base.
Deborah Hendricks is asking, what can diabetics do to protect themselves?
Well, my PSA for all diabetics: control your sugars.
Yeah.
First and foremost, control your blood sugars, because the higher your sugars are, the lower your immunity, the harder it is to control anything. So take your medication as your doctor recommended. Go to follow up with your doctor to make sure that you're being taken care of on your diabetes. And the rest of the stuff we've been saying. Wash your hands. Don't touch your face. I promise I wasn't touching my face earlier. I was touching my hair.
Yeah. I keep pushing my hair out of my face, but I'm like
pushing it back. Wash your hands. Don't touch your face after that. Cough into your sneeze into your elbow, and into your elbow to avoid the spread, and get plenty of rest. The stronger you are, the more rested you are, the less likely you are to catch infection. So a study was done with flu patients and common cold patients, that those who got more hours of sleep tend to fare better in catching infections. So so get your rest as well and stay healthy. And again, control your sugars. Talk to your doctor if your sugars are not well controlled.
A lot of people wondering about the differences between the flu and coronavirus, and so we get a lot of questions in that vein. But it was just here. Oh, Maria Almaraz is asking, will a regular flu test come back positive if you indeed have coronavirus?
I don't think they test for the same thing. So this is why we have to do the coronavirus test. So
very specific.
Yeah, the flu test. If the flu test is positive, of course your doctor will treat you accordingly. And there's even if you're test positive for the flu, there's going to be a less of a chance that it's going to be coronavirus. So again, to my point earlier, if you have symptoms, even if it's sniffles and flu symptoms, go ahead, call your doctor, because they'll want to still test you, because if you test positive for something different, it's less likely to be coronavirus. The coronavirus is kind of one of the things we learned about it. It doesn't really like to be it likes to steal a show. It doesn't want to share the spotlight with other infections. So if you have the flu or the strep, there's like a 2% chance that it's not going to be coronavirus. So. And in fact, if you test positive for the flu, you still need to get treated for the flu. We don't want you to hang out with the flu.
No.
It's still going to be, it's an awful infection in and of itself. So it's nothing shabby. So if you have high fevers with body aches that start quickly, I want to talk about this difference if I can take a second.
Yeah, absolutely.
One of the questions that we asked was, what are the differences between flu and coronavirus? Or so that question comes up all the time.
All the time, yeah.
The quick onset, the flu will start symptoms within hours. So I have patients who classically tell me, I woke up great this morning, at noon I felt kind of yucky, and by 3 o'clock I had a fever, by 6 o'clock I was sweating and had body aches, and I started having more symptoms. So in this hour span of in a span of hours,
like,
you can get the flu symptoms.
Within a day.
Within a day.
Yeah.
With the coronavirus, it's a little lazier. It takes a few days. The median days or average is about 5 days.
Until you even, so, and I guess that is the issue, because we keep saying, well, 80% of the population has very mild symptoms, but that is probably the population that is spreading this illness because they don't even know they have it.
They don't have it, right. The window we have patients who can develop symptoms within 2 days, sometimes it could be 14 days.
Wow.
The average has been about 5 days. Flu within hours.
Wow.
And you're infectious, you're able to pass this on to others before they start developing symptoms too. So a key difference, within hours of starting your symptoms, it takes hours to start the symptoms for the flu, high fevers, those body aches they just sometimes even bone breaking. So if you have those, call your doctor. You have 48 hours to get tested for the flu so you can get on the right medication if you have any contraindication towards medications for that.
We talked about diabetics being at slightly higher risk. We talk about the elderly, obviously, anyone with respiratory issues. But Vanessa Denning is wondering, if you suffer from seasonal allergies, should you wear a mask? Are you more at risk?
There's 2 questions there. The mask answer has been no. The CDC has said wearing masks does not prevent it. It doesn't. The only times we use masks, even in the hospital setting and even in the clinic setting, is once you're having active symptoms, and because we're concerned that you might be a carrier, we'll give you a mask at the hospital or in the clinic and walk you through the places to lessen your exposure to others.
Yeah.
But once you already have symptoms, or if you're taking care of someone with symptoms, that's the only time you wear a mask, not before that. And usually having seasonal allergies doesn't put you at more risk. If you have lung conditions, asthma, COPD, more likely that those would do it, but not so much with allergy symptoms like the sniffles and the stuffy runny nose and the watery eyes, less likely.
I have an elective endoscopy scheduled. Should I cancel?
Call your doctor.
Yeah,
Call
figure
your
that out.
doctor.
Call
That's
your
it.
doctor, yep.
Yeah, that's a lot of time went into that, getting that scheduled, and you might need it because it might be life-altering, so call your doctor before you just up and cancel it.
Endoscopy. Okay. Also, someone was asking, what if you have the flu, you had it last week, are you more susceptible to catching coronavirus from here on out?
From here on out?
Yeah.
Not forever, not for the rest of your life, no. The flu probably knocked out your immunity a bit, which would put you in an immunocompromised state and easier for you to catch bugs. I'm not gonna not put coronavirus in that list, so you could still, but it's not going to be something that for the rest of your life you'll always be a higher risk.
Okay. Vanessa Denning, I am looking at the questions. I want to let you know I'm so sorry. We're kind of scrolling through, and I'm trying to get ones that can answer a question for a lot of people. So ask your questions. I'm trying to get to everyone. Please be patient.
Thank you for your patience. Too.
Yes,
you guys
absolutely.
Have great questions
really
too.
Great questions
Thank you
here.
for that.
Yeah.
So.
All right. So we talked about, will a regular flu test come back positive from the coronavirus for the coronavirus? No. 2 different tests.
2 different bugs.
Absolutely.
2 different tests, 2 different bugs.
Okay, and that is from Maria. What about mosquitoes? We have mosquitoes here. I've seen a lot of them, especially with our warmer weather now.
I know.
Do we know if there's anything in relation to transmission in regards to mosquitoes?
We haven't heard about vectors, about mosquitoes being vectors or fomites. So right now it's strictly respiratory. Right now we are the mosquitoes as adults, as humans. So avoid humans, but to some extent, again, avoid the crowds.
Yeah,
Yeah,
absolutely.
Avoid the crowds, yeah. No, mosquitoes are not to blame right now.
Sue Thompson, saying, okay, folks shouldn't be getting on planes, but what about the bus? Are bus rides something to avoid as well?
It goes back to what we said earlier about crowds. It goes back to what we said about proximity to people and about surfaces that are could be contaminated. So it's a difficult question to answer in the sense that if that's the only way that you have to for transportation, your only mode of transportation, you may need to take some precautions, wipe down your seat, wipe down the railing, again, covering yourself if you can. If that is the only way for you to get around, like to your doctor's office or to do your vital shopping and whatnot. But, it's a good. You raise a good question, and it's something that we're extrapolating based on what we talked about with airplanes.
Yeah, you really have to weigh the risks.
You do.
Yeah.
You really do. Yeah.
Yeah, absolutely. Let's see. How are antibiotics helpful with the virus if they lower your immune system?
There's a lot in that question. So let's lead with antibiotics don't work on viruses. So we can't give you antibiotics for this virus.
If you're taking them for something else.
If you're taking them for something else, there's always that question. They're lowering your immunity. Could they affect this? It possibly could. If you're taking antibiotics for something else, do talk to your doctor if the duration of the antibiotic, if you can shorten the duration or whatnot, or is it absolutely necessary to be on antibiotics for a particular reason. But you do want to consider that. And the antibiotics are making your immunity work harder to fight off a different bug. So it's not so much maybe the antibiotics that are worsening your immunity, it's whatever bug the antibiotics are trying to fight. So if I have a patient just earlier today that, or any day that you can see a patient who's on antibiotics for a long course for a medical condition, or even like chemo patients. They're on these things. It's not so much that the medications alone can cause their immunity to drop, it's whatever they're fighting. So you have to think about it in both ways. So your immunity is low.
Okay. We can just take a few more questions because it looks like we have to wrap this up soon. Penny Brown Shannon asking, she has 3 autoimmune diseases. Should she be staying home?
Absolutely.
Perfect.
I think so. Ask your doctor. Again, disclaimer, you should contact your doctor. But without all the information in front of me for her, I don't know what medications she's taking, so I can't give a full answer. So you might be on medications that drop your immunity or make it easier and more susceptible for you to catch things. But you might also be one of the lucky ones that has a really well-controlled medical condition. So my gut says maybe not, but again, talk to your doctor, because your doctor might say, oh no, you're fine, your counts are high, you're super well, you should be able to go at least to the grocery store for shopping.
Tara Slovarp is asking, my daughter is having her baby next Thursday. Should we limit visitors? Now, this is interesting because the first thing I thought was, okay, kids, it's not, we're not seeing high numbers, a high number of cases in them, but still, newborns. Mom, newborns and stuff. Newborns. Exactly. Limiting visitors. Just just kind of saying, hey.
It wouldn't. I think it's not a bad idea. Because the baby's immunity is still fledgling when they're that baby, when they're that newborn. My PSA for that is if you haven't gotten your pertussis vaccine and you're going to be taking care of that baby, get your whooping cough vaccine for that. Think about that as well, and as well as the flu shot, because yes, we need to take care of the baby, everyone around, and limiting. It's not a bad idea. I think it goes back to what we talked about, droplets and proximity to people.
All right. Isabel Valdez with Baylor College of Medicine, thank you so much for answering our questions. We know you have so many questions, and I'm sorry we couldn't get through all of them today. But here at KHOU, we are bringing experts in daily, and we're going to be having this conversation, and hopefully we'll be able to answer some more of your questions directly online. So that will help as well. But we have answered a lot, so if you're just joining the conversation, you can replay this. We've answered pretty general questions, hopefully, that will get you most of your answers. So again, thank you so much. And thank you to our audience for joining us. We'll see you for the next one.
See ya.